Good morning. It's time to get in touch. Brought to you by Geisinger Muncy and Jersey Shore. State-of-the-art healthcare close to home. Every week, this public affairs show shines a spotlight on people and programs in our communities that improve the quality of life in Lycoming County and beyond. I'm Freddi Hammer, host of In Touch and news director at Backyard Broadcasting. Today, we're talking about something a lot of women tend to put on the back burner, which is their own health. And we have a local event coming up with Geisinger Medical Center. And we also have on the phone today, she is a nurse at Geisinger, one of the women's health operations managers at Geisinger Medical Center, Ellisa Concini. Hi, Ellisa. Thanks for joining us today.
Hi, Freddi. Thanks for having me.
I'm so happy that we can talk about this big event happening on May 2nd. And I guess if we want to just sort of get started with those basics, what is the event that's happening on May 2nd?
Yes, this is so exciting. So it's going to be an event at Geisinger Muncy Medical Center. Mm-hmm. So really nice local area, wonderful setup there. It's a beautiful newer hospital in our system. And it's really the goal of this event is that it's a one-stop opportunity that looks really to focus on prevention, early detection, and overall wellness of women. Very, very special event. Women's health is near and dear to my heart. The team really has designed this to make it easy and convenient for women across multiple areas, all in one stop. All ages of women are welcome. And really, if you're due for your screenings, we definitely encourage you to come. Or if you just really want to know more or learn more, kind of socialize and see what there is to offer, that's welcomed as well.
That's awesome. You can just walk in. No need to make an appointment. You can think about it in the morning and head on over there.
Yep, absolutely. So we're offering things like mammograms and pap smears which we do encourage appointments for those, but we plan to offer to walk in as well.
And you say there's no registration at all?
No registration's needed. You can just walk in, but if you do want one of those tests and you kind of want a guaranteed spot for them, then, calling is encouraged.
Okay. Well, then this event is toward all women. I mean, we're talking teens to elderly.
Yep. The location really allows it to be accessible to anyone, so there's something to learn for everyone, for sure.
So why does this matter so much? I mean, why is this coming up now?
Yeah, so I think in Muncy in particular, we have a really awesome mix of clinics and services there that allow us to serve the community and women in our community really well.
Okay.
So I think, I'm a nurse as well as a manager, and so I think about the patients and the families that I know that really could have prevented things like cervical cancer, sure, just by prioritizing their health and getting some early screening. So women often, usually the caretakers of the home, a lot of women work and, parent their children, and we don't tend to prioritize our own health and wellness. So really, this is just an opportunity to kind of get it all done at once.
Yeah.
Have a morning out and take care of all those needs. We really care for other people. I think it's, built within us as women, and
sure,
really this is a time to put yourself first.
It sounds like it can be like a girl's morning out.
I think so. And, the location's pretty great. There's lots of great things to do in that area. So
yeah,
hopefully there's good weather and, you kind of get your girlfriends together or your mom, your grandma, and your daughters and sisters and friends and come out for sure.
You said that this being a women's health operations manager with Geisinger is near and dear to your heart. Why is that? Is there something that's occurred in your life that is important that you work for?
Oh, gosh, yes. So when I was in nursing school, my grandmother was diagnosed with cervical cancer.
Okay.
And she actually ended up passing away from cervical cancer.
So sorry.
Thank you. She is truly the light of everything that I do and keeps, my North Star very much, ahead and in front of me. So I think about situations where, you might just have to put it off. Maybe you're nervous about getting your pap test done. Maybe you're busy. There's so many reasons why. Maybe you think it's normal that, you're having some abnormal bleeding after menopause. And I think, that's really the time where we want to get you in and get you screened, because cervical cancer is preventable. And if it's detected early, it will definitely save lives. And we have an excellent team that can help our patients, our women, our communities through that. And so I would love to see folks come out, get their testing done, and hopefully it's all clear, nothing concerning. But if it is, get the care that you need and live a long, healthy life.
That's it. If somebody feels healthy, you get the screening anyway, because some of these symptoms don't really show right away, right?
Yeah. So, I think about heart health too for women, often unnoticed. I mean, women can have heart attacks and not even know.
Right.
And so the offerings with the heart screenings that they're doing, blood pressure, all of these things can kind of be silent, especially in women. And we really want to, see if we can detect anything early, or just give you the peace of mind of, everything's looking really great. And, come back next year for your follow-up or for your, well visit. So a great way to kind of establish care if you need that, and you're not yet established with a care provider, but also to just make sure that, you can live another healthy year of life and get in that routine of putting yourself first.
What do you think the common barriers are for women to not come in and get healthy screenings and figure it out?
I think some of it can be, certainly cost, fear of finding something that's wrong.
Sure.
But also, I think more commonly, it's finding the time to do it. And if you're feeling good and there's no concerns, a lot of times you think, okay, everything's fine. Those preventative screenings are really something that can help to make sure that everything really is fine. And so I think sometimes we have issues, with transportation and, getting somewhere. So I love that there's so many different screenings that you can get done and information that you can receive. It's just one trip, one time, versus, having to go back and forth to several different appointments.
Now, at the Muncy, is it going to be, what's it going to look like? Are people going to just walk into the lobby and go to their respective testing areas, or is it going to be kind of like a festival?
Kind of like a festival, I guess you could say.
Okay.
So, so we've done a couple of other events there, and this will be similar, but you will walk in, there'll be some information and, different areas that you can visit. I know we've got someone there doing blood pressure checks. Any of the clinical things or testing will go into those testing areas. So, for example, if you're going to get a mammogram, they'll take you into where the mammograms are. But there will be a check-in area. There's some giveaways. I hear there's some really cool bags that they're giving away. So, ways to kind of go around it, kind of like a vendor or a craft fair, but for women's health.
That's great.
So you can go to, go to each table, learn about why it's not normal to pee a little when you cough and that sort of thing, and see what see those, those areas and be able to ask questions. No pressure, of course. If just because you're there doesn't mean you have to get a test done. You can just ask questions and learn more and see what it's about. You certainly are not required to have any testing done to come to the event.
Well, you're talking about the different things that are offered. Can we go down the list of what's going to happen on May 2nd from 8 a.m. to 1 p.m. at the Geisinger Medical Centerin Muncy?
Oh, I think that's a great idea. Okay, so I have a list here that I'm just going to take a look at to make sure I don't miss anything. The screenings that will be offered include mammograms, cervical cancer screening or Pap screening, blood pressure checks, cholesterol and glucose screenings, EKGs, which screen for heart health, and other topics. There will be some conversations occurring as well. Some key areas that women should stay on top of and understand is breast health, cervical health, heart health, and then really ultimately, even when you're feeling healthy, why screening is still important.
Talking about mammograms, they're not as invasive as I always thought. Like when I first got one, this is fine.
Yeah, it can be that kind of fear of the unknown. I've never had one before. What does this mean? I actually have a friend. I myself have had a mammogram recently because of a lump. Thankfully, everything was clear. That peace of mind was invaluable, like knowing that there was a way to know more. But a friend of mine just had one recently and has to, get some additional testing. And, I'm just 38 years old. I think she just turned 40. So we're in a situation where it's very real, and I'm sure everyone can understand or even relate to or may know someone who has had some sort of abnormal breast tissue that needed further testing or an abnormal mammogram. So this is the time. Come and get checked so what steps you might need to take.
This is also teaching people sort of to have the conversation. This is to
exactly
and talk with your family.
Yeah. Yes. I think especially as our young women kind of enter into ages that they may need to be concerned about some of this stuff. What does it really mean? How can you as a mom explain this to your daughter, the importance of these things? And so really that, I think what's nice about a health fair is that you don't have to necessarily act on anything or do anything aside from listen and ask questions.
Yeah.
And then you also have the opportunity, if you're feeling really called or pulled to get that screening done, you have that opportunity to do that as well.
I guess this is also an opportunity sort of to overcome all these barriers that women don't get their health checked, and maybe to encourage them to continue to look forward and do more screening.
Oh, absolutely. And I think because this is, kind of a one-stop shop, there's multiple services in one place. It could be a minimal time commitment. You could walk through the whole thing, or you could, stay for a short time. It's open from 8 to 1, so that allows, for you to come in as you need, as you desire. It doesn't mean you have to stay there at all for the whole time. And I think that, that one-stop shop is really what I think is nice about this. I wish there was something like this, when I was kind of getting more into women's health and getting my preventative screenings done when I first, had to do that, just to kind of know and understand what to expect.
Sure. The fact that it's close in Muncy, that's also sort of overcoming a barrier that people are really close to this hospital.
Oh, absolutely. And I think the community access is so important. We have subspecialty women's health providers that go to Muncy regularly. So the nice thing is, really, if you find that this is a comfortable place for you to be, you could establish care there. You can get all of your care. There's primary care, general women's health care, and then we have urogynecology, gynecologic oncology if there is a cancer diagnosis, a women's health cancer diagnosis. And then there's also wonderful services like dermatology, and you can't really go wrong with going to Muncy for the care, because it's really that kind of one-stop shop.
Are you going to be at the health fair? Will you have a duty to do?
You bet I am. When Danielle, who's one of the nursing directors, reached out about collaborating with this, I thought, this is the best thing I've ever heard. We've been really trying to get something like this off the ground, and she's been so engaging with it. And so, of course, I'm going to be there. I had my calendar marked, I think, as soon as I knew about it, I'm like, blocking my calendar. I'll be at one of the tables, helping to give out information. And if there's anyone that needs to get a pap smear scheduled, I can help with that. I'll be there for sure, and definitely looking forward to meeting the community there.
I'm wondering if there's going to be people, sort of like spokespeople that are patients, or if there's anybody that's going to be around. You might meet them there. I'm thinking people also at the tables. It's probably a very friendly experience.
Oh, yeah. Some of our providers will be there for sure. We have Lydia Singer, who is one of our PAs. She serves our urogynecology and our fertility clinics here at Geisinger. So she's got a lot of knowledge. And then we have another PA who will be doing, Elena, her name is, she'll be doing the PAP screening. So aside from that, I think there's going to be folks from all kinds of different areas as well to help answer questions like primary care, cardiology. I even heard maybe there would be cosmetics and plastic surgery too for those that have interest with that.
That's so amazing. That's going to be a whole gamut of things. Wow.
Oh yeah, for sure.
So you talked about the the person for fertility. Is there an IVF program within Geisinger?
Yeah, so Geisinger Medical Center in Danville can do the procedures associated with IVF or IUIs, which is insemination. And so anyone that's kind of concerned or wondering about fertility, you definitely have a great resource that will be there to talk you through what you need to do next. We offer both video and in-person visits in Danville. Is where we do the procedures that, if you're getting an egg retrieval or an embryo transfer, that will happen in Danville. But if you want to, establish or, understand where where you're at in your fertility journey. If you're having trouble getting pregnant, or any questions, you can do a video visit with our advanced practitioners, our PAs, and they will get you started. And then we have a wonderful physician, Dr. Jenny Gell, who will be able to go ahead and help you with any procedures that you may need.
What would you like someone coming to this event, what would you like them to take away from this whole thing, sort of the general idea?
Oh, yeah. So I think in my heart, the takeaway that I would hope gets you there is, taking a couple hours out of your day could save you time and add years to your life. Mm-hmm. I mean that in the most sincere way. I would say that for any event related to preventative care and women's health, watching my grandmother suffer through cervical cancer, knowing that could be prevented, really was hard. Mm-hmm. And so I don't want to see anyone, I would hate to see anyone have to do that. So encourage your family to come. If you know someone has been putting off a screening or you're worried about your loved one's health, encourage them to come. If it's a situation of childcare, hey, bring them in the stroller. I'm sure that, we're welcoming of all. So bring them in the stroller, walk them around. It's not,
women are going to understand.
Say, hey, hang out in the car. Hang out in the car with the kids while I go in and just get a couple things done, take them for a ride and take that time, because it will be invaluable just for the peace of mind or that early detection.
Have you seen any sort of decrease in cervical cancer since the vaccinations for the HPV virus has come around?
Absolutely. I can't quote the numbers off the top of my head, but the HPV vaccination, it is really the only vaccine that prevents cancer at this point. It can be given in, or as early, I think, as 9 years old. Okay. And with the way the world is moving and changing, some may think, wow, why would I want to start that, with my 9-year-old? But really, prevention is key. And HPV is easily transmittable. A few different ways you can contract it, but prevention is so key. Mm-hmm. And there's, some types of HPV that cause cancer, and those are really the types that we're trying to focus on with prevention with the vaccine. Rates definitely have decreased overall because of the vaccine with cervical cancer, but what we often see that women are having something abnormal, they're having menopausal bleeding, or, menopause has occurred and now bleeding has started again. Okay. And they kind of put it off, or they think it might be normal. And, it isn't. We want, once you've gone through menopause, you shouldn't have that. And so I think about that early detection to really get it before it gets worse.
In fact, personally, that situation happened. Here I am in the middle of menopause and had that situation happen where I came in for an extra test to make sure that nothing was wrong. And luckily, nothing was wrong at that time. So I'm happy that Geisinger could help me out there.
Yeah, there's all kinds of reasons for it, but we definitely, testing and preventative, the pap smear for sure. Mm-hmm. And there's other types of ways to test for HPV that early detection is so key. But I'm glad to know that it was nothing. Yes. But I commend you certainly for coming in to get checked out to make sure.
Well, thank you. Well, we're looking forward to this event that's coming up on May 2nd, 8 to 1 at Geisinger Medical Center in Muncy. It's a really big step. That's a simple one that can really help people for the rest of their lives. I mean, really, if there's somebody that's nervous or hesitant, what would you say to them?
Well, I would say, hey, if you're really nervous, come find me. I will support you through whatever you need to go through. Ask for Ellisa. Say she told us she'd help us through this, but really, ultimately, bring a friend or bring some music. Bring something that kind of calms you and helps to make you feel more comfortable. And ultimately, even just talking about it is a first step. Yeah. Again, you don't need to come and get a test done, but if you just come and talk about it, that will help you. I think, to help ease that fear and that worry, down the line for sure.
You sound so friendly. I'm thinking people are sitting there going, I'm going to find her and ask her for help. I think that's wonderful.
I mean it. I would help it. I would help anyone through that for sure. So, yeah.
Well, we're
looking forward to making new friends.
Excellent. Well, we're so happy to have you on In Touch today. This is Ellisa Concini. She is a nurse at Geisinger and one of the Women's Health Operations Managers. What exactly does that mean, an operations manager?
That's a great question. So I get to serve the teams of folks that care for you when you come in for your women's health subspecialty appointments. So what I do is I supervise the clinic, and we have excellent clinic-based leaders that I help support, and we make sure we have access so you can come in and get appointments when you want them. I, certainly work on initiatives like this to help with the community and a lot more, but really supporting the staff so that they can provide the best care for you possible.
Okay. Well, it's a wonderful opportunity to the Geisinger Medical Center's Women's Health Screening event coming up on May 2nd from 8 to 1. And like you said before, if you wanted to make an appointment for a mammogram or Pap test, you can totally call, and I'll tell the number. It's at 570-308-2475, or just walk in and talk about what you need.
Exactly.
Okay. Well, thank you so much, Ellisa Concini, for joining us today on In Touch. It's been a pleasure, and thank you for all the work that you do.
Thank you, Freddi.
In Touch is locally produced in our studios at 1685 4 Mile Drive in Williamsport. To get in touch with us for questions, comments, or topic ideas, call weekdays 570-323-8200 or email me at fhammer@backyardbroadcasting.com. For archived files of our In Touch shows, find our Backyard Podcasting link on any Backyard Broadcasting website, or subscribe to our YouTube channel, Backyard Broadcasting. The programming discussed here on In Touch does not necessarily reflect the feelings or opinions of the management or staff. Thanks for listening to In Touch. Brought to you by Geisinger Muncy and Jersey Shore. State-of-the-art healthcare close to home.